the line, Rear Admiral John Menoni from Joint Region Marianas. Good morning, Mr. Menoni.
Good morning. How are you today?
Holding in there. How about you?
Good. Very busy. Lots of phone calls and outreach and planning, but it's good to talk to you. Thanks for having me on.
Oh, no, thanks for accepting the invitation. We hope to continue to have you on more frequently. And as you said, there's a lot going on your end. And if you could just, it's been a while since we've seen you in the Zoom press conferences at Adaloop. So if you could just bring us up to speed with what's happening in your neck of the woods.
Those press conferences were primarily focused around Theodore Roosevelt.
Right.
And I got to tell you, a little bit of hindsight now looking back on that, it looks like a big success for the people of Guam and the local military here, how the team pulled together and helped out sailors who were working through a tough time. And granted, that was at the beginning of this COVID crisis when we didn't have as strong an understanding as we do today. So in terms of, success for the community and success for the military, I'm pretty pleased and really happy at the way we all work together to help out our shipmates, and that was a big win. Through the summer, we saw that we were holding strong with respect to cases here on Guam and in the CNMI. Everybody, I think, was, hyper-focused on what was going on. And then of late, you can see with respect to COVID-19, maybe we collectively let our guard down a little bit, or maybe a little bit of COVID fatigue set in, or maybe, it just came in through a way, we weren't anticipating, because it is pretty amazing how flexible this virus is. Mm-hmm. And now we're having to respond both in the civilian community and in the military to a rising number of cases. Thankfully, we haven't seen a massive surge into the hospitals, and we're working through treatment. We've learned a lot with TR and through the spring and summer on how to treat better. But we're having to work through this process together. Mm-hmm. So that's kind of at job number one these days is this COVID response. But I think we're going to win this thing as long as we keep working together as a civilian military team. Mm-hmm. So I'll hold there, as that helps give you an update of what I'm dealing with.
Mm-hmm. You said lessons learned. What were some of the lessons that were learned from, I guess, the first wave, and what happened with TR? And what are you applying and changed today in terms of the response the military is providing?
So I'll tell you, the big one, and it's almost, you can't argue against it, is that the preventative measures and the mitigation measures to protect yourself and your family and your shipmates work. So masks work is a simple one. Physical distancing work. And I'll give you a little bit of empirical data on that. TR had roughly 4,800 sailors on it that may or may not have been exposed. Of that, roughly 1,200 sailors at the very end, the final numbers were positive in some manner. Because a lot of those sailors and a lot of the leadership was confined to the ship or confined to quarters because they were either exposed, positive, or, we're working through that with them. Your team here, your military leadership had to step into that role in some manner. That involves, walking around to the different areas where we had people quarantined and isolated, making sure we talked with sailors and understood why, what their issues were, how we could make things better. Seeing them face-to-face on a daily basis. That's the only way you can truly do leadership, is that management or leadership by walking around. Mm-hmm. To support the sailors out in the hotels and then on base, you had almost 1,000 people that were interfacing, that were military or military-affiliated, interfacing with them on a daily basis, whether it be medical checks, dropping off food, taking out trash, changing out linens, transporting to and from, helping to deliver care packages. We did not have a single transmission or cross-contamination of COVID-19 between those 1,000 people that were working that process. I've been tested 4 times, and I was in those quarantine areas, face-to-face with those sailors. I wore my PPE, meaning my mask, my glasses if I was in close, washed my hands, physically distanced. I've been tested 4 times. I've been negative. So PPE, personal protective equipment, masks, and physical distancing work. If you don't do that, and because this virus has the ability to sit dormant or sit in somebody that is not symptomatic, they're not showing signs, but they may be contagious. If you don't put on your mask or don't physically distance, you could be the vector to transmit the virus from somebody through you to somebody who's more vulnerable. And that more vulnerable person could have a real tough time with the virus, even though you never showed symptoms of the virus. So again, PPE is not just to protect you from getting the virus, it's to protect the person, your neighbor sitting next to you. And so thankfully, even in my inner office here with my close staff, we haven't seen a transmission amongst ourselves because everybody wears the PPE and washes their hands and physically distances. That's a huge lesson learned for us, that those measures work.
Well, what about, what is the Navy's procedures when the Navy, as an employer, are notified of a possible COVID exposure and or positive results among their civilian, active duty, or reservist personnel? How do you guys handle that?
So you almost go into overdrive on that type of thing. So we pretty much mirror what Gov Guam does also, in that if, say, my aide-de-camp who's sitting here listening to this is suspected of being COVID positive, so, influenza-like illness, has a sniffle or whatever, that's the first thing we do is we kick him out of the office and send him to the hospital to go get tested. Go figure out if you have this. And then we aggressively contact trace that individual, not only for his family and the health of his family, but anybody he works with. And if there's close contact, typically within 6 feet for a period of time or on a daily basis over time, we're going to quarantine those people or isolate those people. If we see any transmission, we're then going to, contact trace, say that I had some sort of then sniffle or bad throat or something like that, and we suspected me of having it. We would contact trace me. And then we're just going to start locking people down, because what we can't do is have this get inside our operational units that have to deploy, think ships, submarines, expeditionary units like the Seabees, because, at remote locations or on deployment, medical care we don't have enough providers. You can't put a whole hospital on a ship. It spreads through ships really quickly. And then what we have to do is do the big 3 that Admiral Aquilino, who's Pacific Fleet, tasked us with, which is protect our people, don't be a vector of this virus into the civilian community, and preserve our mission. If we can't do our mission, why are we out here? Why are they paying my salary? So mission's got to come first, and to do that, we got to protect our people. So that's kind of what we do. It's very aggressive, and it's very hard. It's very resource intensive for both Gov Guam and for the military here to pursue that course of action to make sure we can do mission and protect our people.
Right. As the number of positive cases have increased, and in the CIT report, it separates the increases in the civilian population and in the military population, and so we do see this increase in military service members testing positive for COVID-19. It doesn't break it down in terms of if it's Navy or if it's Air Force or if it's active duty National Guard. But one of the things that has been discussed is this hospitalization rates. And for Naval Hospital, where are we with the hospitalization rate there and the bed capacity and resources that are needed to treat COVID patients?
So as of my last official report, which was yesterday afternoon with respect to the U.S. Naval Hospital, there were no inpatients with respect to COVID-19. Obviously there's other things that they're dealing with there. But so bed capacity and ICU capacity is good, and we watch that very closely. We also watch the civilian bed capacity, ICU capacity, because I see that as a leading indicator. And then as part of this community, should the governor and the government ask, we may be tasked with responding to help, like we would in a typhoon or something like that. So we watch the local hospital capacity, both at GMH and GRMC. We watch our own capacity, which, again, right now I don't think I have anybody in the hospital, but I'll get a report later today on that. And then, as I've communicated before, we have some additional capacity here that we held on island, that my boss is in Hawaii, and I work through with the medical community to hold on island should GovGuam ask for help, and should we be tasked with it, we can rapidly build those things to provide services. And I think one of those things is that 10 hospital that was up at South Finnegayan. We moved that equipment down to the Santa Rita complex, the old middle school down there, sitting kind of in a standby break-in case of COVID glass type thing to be ready to set up if I get called to do that.
Right, I remember that. It was constructed over at, like you said, Finnegan's. And wasn't there a tent also over in Nimitz Hill area?
So it was up at a smaller system called the Expeditionary Medical System.
Right.
It's an Air Force system. That's in storage basically up at Anderson Air Force Base. And so normally with the big tent hospital, the Navy one that was up at South Finn, that came off of a ship. And normally at the end of a crisis, you would pack that thing up and put it back on the ship, and the ship would go back out to sea or wherever it goes, and just sit there in storage. In order to prevent the timeline, the timeliness that you would incur of having to unload that ship again, bring the ship into port, unload the ship, transport all those containers all over the place, unpack those containers and build it. We worked, again, with leadership to hold those things on island. I hate to say it, but we were worried about a fall resurgence of this virus. It looks like it came a little earlier than planned, so that we are postured to help if asked.
And speaking of asks, we had a Navy active duty service member. He flew in to Guam last week. His name's Rob Shaw. Did you want to speak?
Yeah, no, I think he's Air Force.
Oh, he's Air Force. Air Force.
Well, I mean, maybe Admiral, we could just pretend if he was an active duty Navy guy who had come from, let's say, New Mexico. What kind of jurisdiction would the Navy have over someone who comes here for a family funeral who may be on leave for that, and they get put in quarantine and they can't get out?
That's a tough question, and I don't necessarily have the answer with respect to, things that are classified as leave. So obviously, funeral travel would be classified as some sort of emergency leave, and so it is likely that they would fall, since that's not official travel, they would fall under Guam's quarantine and isolation rules. Because we're going to try and comply and align with the civilian community on that. So let me give you my experience. Here's a better one that I can talk to. So I recently finally got on some leave back to Cape Cod, Massachusetts, to see family. That was about a month and a half ago. Coming back on island, the military, even though I was on leave, the Navy dictated that I will go into 14 days of quarantine restriction of movement at a government-controlled facility when I came back on island. And so I complied with that. And thankfully for me, which was a little bit easier than maybe for some of these people, I was able to do that in military housing. But I was stuck in military housing for 14 days, and I was not coming out of it. The only time I was allowed basically out of my house was if I had to come do a secure video teleconference. Obviously, I don't have those systems in my house. So, and then it was back home and sit there with the dog for 14 days. So, that was a unofficial travel that resulted in my restriction of movement because it was leave. If somebody comes in here for official travel, think a temporary duty assignment or a permanent change of station assignment, they're going to go into 14 days of restriction of movement / quarantine on the military. And we're going to do that, and there's no getting out of it, even if you have a test or not. So with respect to the funeral case, I'm going to have to look into that, but I see that as unofficial travel and complying with government of Guam rules. But I'll find that out, and hopefully we'll be able to feed that back to you.
Thanks, Admiral. We had a tip, and in the media when we get these tips, I mean, the best thing we could do is try and get them vetted by people who would know, like you. The tip we had got was that the Navy had just got confirmation that one of their reservists tested positive for COVID after that person voluntarily advised command that public health contacted them through contact tracing for potential exposure. Instead of immediately taking that person off of duty, they allowed him to remain in a classroom with other reservists and sailors. They then sent him for testing at Naval Hospital this week, where he tested positive. They are not taking steps to keep the local reservists safe, instead requiring them to come in to pull duty in the base and expose to a now known positive case.
Well, okay. It is entirely possible that our system is not infallible. However, we don't make decisions based on lack of data. So, I got to tell you, watching the operations that Captain Grimes is running at Naval Base Guam and that the General Sloan is running at the Air Force and coordinating every day, it's a massive operation. And we've got hundreds of people that are either sitting in restriction of movement because of travel or because of close contacts or suspected close contacts that we're putting into some sort of quarantine or isolation. So any characterization that we're not worried about the health of individuals is that's not helpful and not accurate.
Okay. Just real quickly, I wanted to go back to Rob's story, the Air Force personnel. Does it matter, though, that he has orders from the Red Cross?
No, probably not. But again, I'm going to have to look into the legalities of
Right.
because the Red Cross isn't a military organization. You know that, right? And that designation, typically in the death of a family member, that designation of emergency leave, and the Red Cross will say, hey, this is a local parentis, meaning this is a direct parent of this service member, allows commands to turn on things like funded travel and those types of things.
Yeah.
But we're not going to, we really can't take these risks even for funerals. And I know that's harsh, and I know that sounds inhumane, but we could be putting the community, the greater community, at risk to satisfy the desires of the individual. And unfortunately, I'm going through that very situation right now that I found out last night. So, while I would love to travel for a funeral to pay respects to somebody very close for me, I can't do that.
Yeah. I think, Admiral, and then I know that you maybe weren't listening because you had that meeting, but in the specifics of this case, what I think is really rubbing this gentleman the wrong way is that he's asking to be tested so he can get tested out, and they just won't give it to him or whatever. But, Admiral, I wanted to go back to the ask here. So you had said that in the event we need additional, medical facilities, whether they be the tents or what have you, that those will be triggered when the governor makes an ask. So are we talking like in writing? And then can you maybe walk us through the turnaround from when you get that official request to when we're going to see these facilities or the equipment ready for use?
So that's a great question, and it's actually something that a lot of people don't understand, including me. So when I first got here, so the lead federal agency for disaster response is not DoD. It's typically FEMA, and so again, think to a typhoon. What people try to do is they try to posture themselves so they can respond quickly should an ask and then a mission assignment come. And that's across all government agencies. So what would happen would be the governor would say, hey, FEMA, or somebody in the government would say, hey, FEMA, we need some help. FEMA doesn't look at DoD as the primary resource to fill that requirement. Mm-hmm. It's going to look everywhere but DoD first. And that happens fairly quickly. They're constantly updating who could provide resources and who couldn't. And so, FEMA could task a local civilian agency that has resources. It could contract locally to provide those resources. In the event that there's nobody that can fill that gap, that need or that requirement, it may look to DoD and say, DoD, we need you to look at this. DoD would then have to validate that requirement as we call it a valid mission assignment. So FEMA would say, hey, we assign this to you, DoD, and DoD would say, yes, that is valid, and we have the ability to source that requirement. DoD, through the chain of command, and again, these things can happen fairly quickly with phone calls, and then you back it up with emails and formal tasking letters. DoD would then say, okay, who's in the area? And it would normally come through Hawaii, and then Hawaii would task it to us and task it to other units because, again, I don't hold, like a pool of medics or doctors on island that could source this. So they would say, DoD, have at it, and we would build that hospital down there, and they would fly in medical providers. So there is a time penalty for all of that, being that we're on an island in the Western Pacific. But DoD, my boss is back in Hawaii and elsewhere, and locally, is working to, again, shorten that timeline to as tightly as possible so when the call happens, we can build the hospital quickly and get people on planes to provide service as fast as we can.
Sounds like somebody in Adelut better start writing a letter.
Well,
because wow.
You got to look at it from the perspective of, if we can get this thing to plateau, if people do the right thing, then we don't need to make that call because you also got to understand that local governments, there is a copay with FEMA. FEMA's going to ask for resources from local governments wherever they're at, states, territories, to help fund these deployments of personnel, whether it's a locally contracted solution or Department of Defense. So there'll be some sort of copay. So it's something you have to think through. What's the best use of your resources, and is this the right time to make that phone call?
Mm-hmm. Admiral Menoni, by any chance, would you have any information on the start of DoDEA schools and whether or not it's going to be face-to-face or remote learning? So
we've requested remote learning to start 2 weeks. Now, this was not a decision that I came to easily because as the husband of a teacher, I know that in-classroom instruction is the best way to go for most. Mm-hmm. But with the rise in cases that we saw starting roughly around August 9th that we were watching very closely, the governor's declaration of PCOR 1, their decision to go to a remote learning environment, I think it's prudent that we request that. I have a conversation with the DoDEA Pacific director today on that, but I don't see it as an issue that we would start with remote learning. The way I'm characterizing it to military constituents is this is a soft opening. We have to step through the opening of these services deliberately and methodically and I think going remote learning is a good way to start the learning process with the ability to transition to a brick and mortar learning, in classroom learning at a later date, and we're sure we've got this thing licked.
Sorry, I never heard that brick and mortar learning.
Sorry, I'm old.
I know, I get it. I'm old too. Don't worry.
Me too.
Google it, kids. Brick and mortar. It means you at a building. Bree?
Yeah. Was there anything else that you wanted to ask him? Is there anything else you'd like to pass along to everybody? Your final message, Admiral Menoni?
Yeah, so this one kind of goes out to, thank you for that. This goes out to kind of the beneficiaries of the bases. You know, there's a lot of angst and nervousness that we're going to have to close off services at all the different installations on island. And the intent today is to kind of hold what we got. You know, we may have to elevate our health protection condition to a higher level. That would likely be at an administrative elevation to align all the different things we're trying to do within the fence lines to prevent the spread of this virus. Mm-hmm. If and when I do that and make that decision, there'll be also a deliberate decision to control access to the bases. And this has never been somebody's valued more than somebody else, or one group's more important than one other. It's about mission for me. You know, I have to preserve mission at the airfield, port, and telecom station. So I may have to segregate groups again or control access. But that will be a deliberate decision that's communicated appropriately. It's not going to be a snap decision that we do overnight and surprise everybody. Mm-hmm. So just pay attention to the Facebook pages, right. Listen to the radio, look at the JIC releases and the JRM releases on that so you're informed. But everybody needs to know it's coming from a position of protecting mission and looking after our people, mm-hmm. and that's it.
When you talk about the HPCon, are you saying that we could revert back to what it was when we saw the first surge, or so even stricter?
Health protection condition Charlie.
Yeah.
Mm-hmm. So that pretty much aligns with PCOR 1. They don't line up exactly right. We're in what's called Bravo Plus, which means Bravo but more restrictive measures. We've tightened things down internally on the bases more because we're seeing, inter-unit spread of this virus that looks like it was transmitted from off-base to on-base, or came from off-base to on-base, maybe through service members, maybe through civilians, who knows. So this HPCon elevation would basically align everybody's efforts under the same thing. You know, there is a level higher than HPCon Charlie that I'm very reluctant to go to.
Is that level Delta?
That's Delta. I don't see us going to that as long as we can continue to control this virus. The hospitals don't get overwhelmed. We don't see mass morbidity. You know, as long as we're working through this together, I think we stay where we're at.
Admiral, there was just one more thing. In the first lockdown, we saw this whole thing where we had the veterans and retirees, and there was a situation with access to the commissary and lines, and so as we are now locally outside the fence line and back in PCOR 1, has the Navy, have you guys kind of retooled what was happening before? Is it still happening? Or are people still, going through that on the Saturday?
So the naval base currently is open every day for all beneficiaries, but the limiting factor on the naval base with the commissary and exchange is the 6-foot distance. So if you map that out in the commissary, you can get roughly 70 people in there at any one time. If you look at it like a smaller NEX, like up at Naval Hospital, it might only be 5 to 10 people at any one time. So if you think about this as water flow through a pipe, unless you make the pipe bigger, you can only get a certain volume through it.
Right.
So the naval base is holding fast on that, and it's been the same way since probably April, May time frame. I think it was May when we went to all days were open, but
Right.
we still have to limit access by numbers.
Okay.
The Air Force Base is open to veterans, retirees, and others on the weekends. And the reason there's a little bit of misalignment there is they're different bases with different missions with different layouts. The Air Force Base Commissary Exchange Complex is right across the street from its most important command and control nodes with respect to airfield operations. The Naval Base Commissary Exchange Complex is roughly 3/4 to a mile away from port operations, the wharves and piers. So, you know, I'm okay with a little bit of misalignment there to preserve those missions.
Right. Okay.
If you do go into HealthCon Charlie, though, are you going to be restricting, I guess,
Access,
yeah.
or maybe changing up who can go when.
Right.
Oh no, so it's not a binary decision. It's not an if then. If Charlie, then we restrict access. If and when I go to Charlie, then we will start working through the process based on the conditions of spread if we need to restrict access further to the bases. So we're not necessarily seeing today that the NEXs and commissaries are the mixing point or the point where we're seeing spread of this virus.
Right on.
So it'll be a deliberate decision. It won't be a, you know, if I do this, then I'm immediately going to snap to restricting access.
Cool.
We'll have to work through that. And I've been keeping the veterans and retiree groups informed of that as we go through that. They seem to be okay in the majority that we're communicating appropriately at this point.
Admiral, we really thank you for this opportunity. We got to
Thank you,
run because we
Admiral.
got public health standing by, but we want to make this a regular thing, and I think that, you know, people want to hear from you, you know, so if we could maybe weekly or however we can arrange to just have you on the show and check in, you know, as part of that civilian military partnership that we hear so much
I'll have
about.
the PAO here, Lieutenant Commander Rick Moore,
Okay.
who set up a more regular drumbeat. We'll
Right.
figure out what works for both of us.
Okay, thanks,
Thanks
Admiral.
a lot.
Thanks, guys.